95% of the WHO's tuberculosis eradication efforts in Europe and over 60% of TB programs in Africa. Today is World Cancer Day. It is a global initiative to improve awareness and knowledge of cancers and the need for early detection for proper medical intervention. The theme for this year's World Cancer Day is United by Unique. This theme highlights the importance of personalized care and treatment. Each year, a specific theme is adopted, focusing on different aspects of cancer care. Cancer is a large group of diseases with one thing in common. They happen when normal cells become cancerous cells, multiplying and spreading in any area of the body. The human genes send instructions to the cells. Normal cells follow the instructions, but cancer cells actually ignore those instructions. The World Health Organization says existing cancer prevention policies and programs are not fully implemented, leading to millions of avoidable cases. It also says cancer services are included in the health benefits package in only 6 countries. Well, let's now speak some more on this World Cancer Day. And joining us is consultant radiologist at the University of Abuja Teaching Hospital, Dr. Amaka Itanyi. She joins us from our Abuja studio. Good to have you join us, Doc. Well, as it is, every now and again, we hear you, well, doctors, cancer awareness advocates talk about early detection. Why is this important?
Well, thank you so much for having me. Like you rightly said, early detection is what we actually preach. And the reason we go ahead to do that is that with everything else concerning our health, when you detect these things early, then the chances of it being treated and the patient being alive actually increases. If it's not picked up early, then it spreads. Like you rightly mentioned, the cancer cell does not respond to the instructions. And so they just tend to divide and just keep growing and growing until they spread around the entire body. And so detecting these things early is the key. So when we pick them up early, then we're able to actually treat them. So it's not usually a death sentence like people tend to believe.
All right, so when you talk about detection, how is it detected? As an individual, can I detect if I have it in any part of my body, or do I need to visit a health facility to get that done?
No, you can actually, you can do your examination. There's some examination that you can do by yourself and others that you have to go to the hospital. And so when we're talking about detecting cancer, we talk about screening first. So when we do the screening means that the person is not having the symptoms, but when we do the screening with the tests that we have available in the hospital, we're able to pick them up early. And so I'll give an example, something like breast cancer. It's something that the patient can actually pick up early by themselves at home if they're able to do their breast self-examination. And so when this is done, the chances of picking it up early actually increases. But the rest of the tests are done in the hospital. Something like a mammogram, you have to come to hospital to have it done. Something like ultrasonography is done in the hospital. But then apart from that, we encourage that you pay attention to what your body is telling you. So if you notice that there's something abnormal, maybe you're having a headache or your tummy is aching, or maybe someone is having diarrhea, it's a time for you to actually check, because our bodies are always speaking to us, but the thing is that we don't get to pay attention.
All right.
So yes, there are some things that we can check at home and others that we have to come to hospital to get taken care of.
All right, doctor. Let's talk about treatment. What can you tell us about, the different intervention, talking about radiotherapy, chemotherapy, and any other helpful medical intervention? What are the differences and how, can they be accessed?
All right, the different treatments, now it depends on the type of cancer, because, cancer can happen everywhere. Every part of the body can actually have a cancer. And so they're all treated differently. And so the treatment of the cancer now depends on the health, on the practitioners. It's not something, there's no one size fits all. And I think that's what the theme of this is talking about, United by Unique. In other words, the different cancers are all different, and then the individuals. So we're looking at the individualized treatment for cancers. So yes, you have medications, chemotherapy, You have radiotherapy, where you use X-rays, radiation, to treat the cancers. And so they are quite different. Now, talking about the treatment, it's something that we all come together as medical practitioners and decide on the particular cancer and how it presents.
All right. And how affordable and accessible are these treatment interventions in Nigeria?
I think the affordability is actually the problem, because they're not cheap at all. They are really not cheap. But interestingly, the federal government has established a national cancer fund. You know, you have like 5 areas, pilot regions where you have this thing. So the patients are able to access this fund to be able to treat the cancer. Now, the problem that we are having is that a lot of the treatments and even the investigations are done out of pocket.
All right.
And so most people cannot afford it at all. And so if the health insurance is not covering this, then it makes it absolutely almost impossible for the normal person to get treated. So that is a problem for us.
Okay, then. Thank you very much. Radiologist at the University of Abuja Teaching Hospital, Dr. Amaka Itanyi, for talking to us on World Now.
Thank you so much.
Well, that is World Now. Thank you very much for being a part of it. Remember to get updates on the stories we're monitoring on our website, www.tvcnews.tv. Be a part of our online community. Follow us on Facebook, Instagram, and X. Our handle is @TVC_NG. On YouTube, we are live at TVC News Nigeria. We have updates on WhatsApp at TVC News Nigeria. Thank you again for watching.